First of all, I would like to express my sincere gratitude to Professor Serro for inviting me to the traditional 26th International Conference. I will talk managing ectopic pregnancies by targeting hyaluronic villi with a transvaginal injection of ethanol into the lacuna space, its safety and efficacy in 242 cases. For last nearly 40 years, MTX has been recognized an effective drug for treating ectopic pregnancy and has been used as a non-surgical medical treatment in various protocols, including both local injection and systematic administration. The problem with MTX treatment is that it does not apply to patients with high beta HCG or fetal heartbeat positive. In addition, it takes 5 to 7 days from the first dose to the effect and 2 to 3 months before the serum beta HCG level becomes negative. In the conventional method, after separating the liquid in the GS, MTX is injected into the GS. In contrast to the conventional method, trophoblastin targeted therapy doesn't inject ethanol into the GS. The ethanol injects into the lacuna space, which appears as a hyperechoic white ring around the GS. In 26, we reported treatment of ectopic pregnancy with local injection of absolute ethanol into the GS. However, as a result, it was confirmed that it was effective for early ectopic pregnancy up to 5 weeks gestational age. It was insufficient for high beta HCG and fetal heartbeat positive cases. Why do drug effects change as a pregnancy progresses? We focus the phenomenon of change of drug effects from weakening to ineffective with the progression of pregnancy, consistent with the phenomenon of shift of GS composition in early pregnancy from hyaluronic sac to amniotic cavity. This transition process in which the hyaluronic cavity is overtaken by amniotic cavity in the changing membrane structure of the GS. Finally, amniotic membrane and hyaluronic membrane are fused together to form the strong amniohyaluronic membrane, which acts as a barrier to trophoblast and block the action of absolute ethanol. Why do the target of drug action change to trophoblast? Syncytial trophoblast erodes material tissue, anchors the villi to the endometrium, and plays the most important role maintaining. Its main functions are exchange of gas required by mothers to fetus, for secreting HPL to absorb the nutrient necessary for fetus from mother, for secreting HCG to maintaining of corpus luteum gravities of the ovary, and regulating the estrogen and progesterone secretion. The lacuna space cannot be observed directly, but is present in the detudural capsules seconded by the hearing reaction around the GS and appears as a hyperecho white ring on transvaginal ultrasonography. Method of trophoblast target therapy. All cases were locally injected with absolutanol at the ectopic pregnancy site with this 23 gauge needle under transvaginal ultrasonic guidance. The effect of trophoblast targeted therapy was judged from the declining rate of the beta HCG before and 2 hours after injection of absolutanol. If there is no effect of absolutanol injection, or the lower efficacy is 15% or less, additional injection was performed. Thereafter, monitored until serum beta HCG reached under 0.3 milli-IU per milliliter. Over the last 14 years, 242 patients have been treated with hyaluronic villi targeted therapy, including 103 patients, 42% with a fetal heartbeat positive. Let's introduce the actual case. I will show you actual case. First case is a tubal pregnancy. This case is 7 weeks 4 days of gestational age. Heartbeat was positive. The GS is on the back of the bladder. Ethanol injects the needle through the bladder directly to the surrounding the GS. I will show you video. Heartbeat was positive. Ethanol injects needle through the bladder directly to the surrounding GS. Trying the inject ethanol locally at 3 o'clock. The ethanol injector flow was observed as a high intensity image. Ethanol is bleeding toward 12 o'clock. But injecting ethanol, don't inject large volume at once. Ethanol leaks into the abdominal cavity, causing side effects of peritoneal irritation. Next, trying the inject ethanol locally from the direction of 9 o'clock. Ethanol is bleeding from 3 o'clock to 12. The key point of each the injection is to applying 1 milliliter of ethanol over multiple small pumps of about 20 times, resulting in 2 to 3 milliliter of ethanol delivered to the villi area of the surrounding GS. Ethanol is spreading almost all around GS. The change of the beta HCG level and clinical progress. Only one ethanol injection was required. The total amount of ethanol injection used was 1.8 milliliter. Next case is tubal pregnancy at 7 weeks and 3 days of gestational age, heartbeat positive, and trying to inject ethanol locally at 9 o'clock. Ethanol is spreading toward 6 o'clock and 12 surrounding GS. And next try so ethanol injection from 2 o'clock ethanol spreading surrounding GS. Ethanol injections are applied 2 to 3 times to various sides of the surrounding the GS. The key point is not to inject into the GS itself, but instead target the surrounding part of the GS. It is important to make sure the GS itself is not ruptured during the process. If the GS ruptures, the injection site will not be found even if additional injections are needed. Alcohol is spreading toward 6 o'clock and almost around GS. Alcohol injecting towards 9 o'clock and is spreading almost all around GS. Now we can see GS. It is very important. This slide shows the change of beta-HCG level and clinical progress. Ethanol injection was required 3 times. Due to poor HCG beta decrease, additional ethanol injection were performed twice. The total amount of ethanol injection used was 4.8 milliliter. Next case is cesarean section scar pregnancy at 6 weeks with heartbeat positive. This slide shows transvaginal ultrasound image of the anterior wall of the cervix detected hyperechoing around GS with a yolk sac and fetal pole and fetal heartbeat positive. The initial serum beta HCG before ethanol injection was about 43,000 milli-IU per milliliter, and beta HCG in the 2 hours following injection of 5 milliliter ethanol decreased to about 32,000 milliIU per milliliter. The rate of reduction was 23.6%. After that, beta-HCG decreased rapidly. GS also shrunk, and on the 38th, beta-HCG decreased to less than 1.0 milliIU per milliliter. A water flow test performed 2 months after the ethanol treatment confirmed that the cervical canal and uterine cavity was normally repaired. This slide is the change of the beta-HCG level and clinical progress. This case was 2 days after the initial ethanol injection. Second ethanol injection was performed because serum beta-HCG increased. In these cases, it was difficult to identify a hyperechoic around GS because the GS was collapsed in the first ethanol injection. So we use ethanol at the site with abundant blood flow using color Doppler due to wide range of localities. Ethanol amount was large and 30 milliliter was necessary. Subsequent beta-HCG decreased smoothly, 1.0 milliIU per milliliter on 37th day after ethanol injection. Over the last 14 years, 242 patients, including 103 patients, 42% fetal heartbeat positive, have been treated. Of the 242 patients, 222, 91% patients were successfully treated. The success rate in treating fetal heartbeat positive patients reached 100% due to its clearly visible implantation site. However, 20 patients, 8.2%, didn't react to the therapy since their beta-HCG level didn't decrease, and hence laparoscopic surgery had to be performed to treat their condition. The main reason for the failure was due to misdiagnosis of the implantation site by ultrasonography. The average dose of absolute ethanol injection was 3.2 milliliter, and the range was 0.3 to 53 milliliter. One 106 patients were able to complete the treatment with 1 ethanol injection, while in the remaining 116 patients, the serum beta-HCG level either didn't decrease enough or increased after the injection. Therefore, these patients required repeated local injection of ethanol. Twice, 34%, thrice, 12%, 4 times, 4%, 5 times, 1.3% required repeated local injection. This slide shows percentage change in the beta-HCG level after local injection of ethanol and its reduction rate. In all patients, serum beta-HCG level decreased to less than 50% of initial level within 3 days. and to less than 80% within 10 days, and to less than 95% within 2 weeks. Let's compare the effects of the local injection of MTX. The effects of MTX are very slow and require 5 to 7 days for the effects to appear. Observation period also require 50 to 60 days. In conclusion, trophoblastic targeted therapy with local injection of the absoluthanol is a relatively simple procedure, effective all types of ectopic pregnancy, including those with high beta-HCG levels or fetal heartbeat positive. In addition, these methods can be performed outpatiently because the therapeutic effect can be judged quickly, which is very beneficial for both patient and physician. Therefore, this method could be an effective treatment for ectopic pregnancy with potential to replace conventional surgical intervention and medical treatment using MTX. In 2019 and 2020, we also reported this procedure of ectopic pregnancy with local injection of absoluthanol into the lacuna space. Thank you for your attention.